Welcome back to Mindful Objective. This is the show where we talk about health that is clear, realistic, and easy to use in your daily life. I'm your host, Dr. Daniel Sproul, integrative health practitioner and professor. Today, we're talking about the thyroid. Here's what I want you to understand right away. The thyroid is one of the most important glands in the body, and it's also one of the most that is misunderstood. Millions of people are walking around right now feeling exhausted, gaining weight they cannot explain, struggling with their mood, their sleep, and even their focus. And they have no idea the small butterfly shaped gland in the front of their neck could be playing a significant role in this issue. The thyroid does not get enough attention until something goes obviously wrong. But the truth is, thyroid function can be off for a long time before it shows up clearly on a standard lab test. That gap between how you feel and what your numbers say is exactly what we're going to talk about today. As always, this show's for educational purposes only. We do not diagnose, treat, or cure any illness or disease. Always speak with a qualified healthcare provider before making any changes to your health routine. So now let's start from the beginning. What exactly is a thyroid and why does it matter so much? The thyroid is a small gland located at the front of your neck, yet it plays a major role in how your body functions day to day. Even though it's physically small, its influence reaches almost every system in the body. When you start to understand how it works, a lot of things begin to make things a lot more sense, especially when it comes to energy, focus, and your overall well being. One of the easiest ways to think about the thyroid is as a regulator of pace. It helps determine how quickly or slowly your body runs. This includes how your body uses energy from food, how your heart responds, how your brain processes information, and how stable your body temperature feels throughout the day. The thyroid produces two primary hormones known as T4 and T3. T4 is produced in larger amounts and can be thought of as a reserve form. T3 is the active form that your cells use to carry out daily functions. What many people do not realize is that producing T4 alone is not enough. The body must convert T4 into T3 to be useful. This conversion process happens in multiple areas of the body, including the liver and the gut. That means thyroid function is not just about the thyroid itself. It depends on how well other systems are working. If those systems are under stress or not functioning efficiently, the conversion process may not happen efficiently. There's also another factor to be aware of, and it's called reverse T3. And many doctors do not test for this. This is an inactive form that in the body can produce certain conditions such as ongoing stress or physical strain. Instead of supporting energy production, reverse T3 can take up space where active hormones should normally work. This does not mean something is wrong in a diagnostic sense. It means the body may be adapting to stress in a way that affects how energy is used. The thyroid is also closely connected to the brain through a signaling system. The brain releases a signal known as thyroid stimulating hormone, or better known as TSH. This feedback loop is designed to keep things balanced. When everything is working smoothly, the system adjusts automatically based on what the body needs. Another important part of this conversion is nutrition. The thyroid relies on certain nutrients to function properly. Iodine is one of the most that people heard about, but it's not the only one. Selenium, zinc, iron, and certain B vitamins all play a role in supporting hormone production and conversion. If any of these nutrients are low, the system may not operate efficiently. This does not mean supplementation is always needed. It means awareness is important, and that's where guided support and proper testing can help provide clarity. From a health coaching perspective, the goal is not to diagnose or label what is happening. The goal is to help you understand how these systems connect so you can make informed decisions about your health. This is also why a single lab value rarely tells a full story. The thyroid is part of a network. When you look at it in isolation, you miss that bigger picture. When you look at it as part of a system, patterns start to stand out. This is where functional lab testing can be useful. It allows you to look at the broader range of markers and understand how different pieces are interacting. So at Mindful Objective, we help clients guide through that whole testing process in a structured, supported based on what it's showing. Right? If you prefer to take a more independent route, you can also run your own self-service labs through Discount TRT Labs and review your results on your own time. Again, the key is not guessing, it's understanding. So when the thyroid function is not operating in a balanced way, people tend to feel it, but not ways that people always connect back to their thyroid. This is where a lot of confusion comes in. The symptoms can feel broad. They can overlap with other areas like stress, sleep, and even your diet. Some people feel like everything has slowed down. They may feel tired even after getting enough rest. They may notice changes in weight despite not changing how they eat. They may feel colder than usual or have difficulty focusing throughout the day. These are patterns people commonly report, but they are not specific to one cause, which is why it's important to approach this with awareness rather than assumption. Other people experience the opposite. They may feel more restless, have trouble sleeping, or feel like their body's running too fast. They may feel more sensitive to heat or notice changes in the energy or inconsistent that are hard to manage. There are also situations where the immune system becomes involved in how the thyroid functions. These situations require proper medical evaluation, are outside the scope of health coaching. That is why it's always important to stay connected with a licensed healthcare provider when these kind of concerns come up. Right? That's where we work hand in hand with your practitioner. Right? You have on the integrative side, the integrative health coach. What we do is we work with your physician, right? We run certain labs they do not run. We look at different things they do not look at. We work together. Always remember that. It's not one solution fits all, right? We work together. And one of the biggest challenges people face is being told on their normal labs that everything's normal, yet they do not feel well. Many of us been there. Many of us heard that. Many of us got frustrated by that. It can be very frustrating, and it's also confusing. It can make people question themselves or assume nothing. This is where education becomes so important and the reason we're doing these podcasts. Feeling off does not mean something is being diagnosed, right? It means there may be more to understand. It may be worth looking at patterns, lifestyle factors, and possibly exploring more detailed testing with guidance of a professional. Another layer to consider is that symptoms often build over time. They do not always appear suddenly, right? People adjust, people push through. They assume it's just part of life, right? Over time, those patterns become normal, even if they're not optimal. Remember, from an integrative health perspective, we look to get the body and your levels at optimal ranges, not just good ranges, not just out of bad ranges, but optimal ranges. That's very important on conventional labs where you may show up in the green, doesn't mean it's optimal. It just means, yes, you're within this range, but you're not optimal. That's something we have to take a look at. This is why awareness matters. Paying attention to changes in energy, mood, sleep, and daily function can provide valuable insight. You're not trying to self-diagnose. That's very easy to do. You go to Dr. Google, you have every disease known to man. You're simply becoming more aware of how your body's responding. That's what you got to look into. And only you know your body. Functional lab testing can play a role here by providing additional data points. It's always good to look beyond a single marker and see how different systems may be interacting with each other. Again, at Mindful Objective, we work with clients to help interpret these patterns and build a plan that supports their overall health. For those who want more control over the process, again, discount TRT labs, run your own labs, and go from there. So the goal is clarity, not confusion. Now let's talk about how the thyroid doesn't function in isolation. It connects to many areas in your daily health, which is why changes in how you feel sometimes trace back to this system, yet it's not obvious at first. One of the main areas people notice is energy or lack of energy. When your body's using energy efficiently, you tend to feel more stable throughout the day. When something's off, people often describe as feeling drained even after rest. This type of fatigue can feel different than just being tired after a long day. It can feel persistent and harder to shake. Metabolism is another area that often comes up. This is not just about weight. It's about how your body processes and uses that food as energy. When that process slows down, people may feel that their efforts are not matching their results. This is not about assigning blame. It's about understanding how that body functions. Is your body functioning optimally? Is your body barely functioning? Is your body not functioning at all? These are all different questions you have to ask and see. That's where numbers play a big part in this. Stress is another major factor in how the body regulates itself. Ongoing stress can influence multiple systems, including those involved in that energy production and the hormone balance. This is why stress management is not just general recommendation. It is a key part supporting your overall health. Blood sugar balance also plays a role. When blood sugar levels fluctuate frequently, it creates additional stress on the body. Supporting stable eating patterns with balanced meals can reduce strain and support more consistent energy levels. Hormones is another piece of the puzzle. The body is constantly adjusting and responding to internal and external signals. These systems do not work independently. They influence each other. That's why a broader approach often leads to better understanding. Sleep is one of the most overlooked areas. Quality sleep allows the body to recover, regulate, reset. Without it, many struggle to function. Is it hard to wake up every day? Is it hard to get through your day? If sleep is inconsistent, it can affect how you feel in multiple ways: energy, focus, mood. We go back to that coaching perspective: nutrition, sleep, stress, movement, and awareness. These are all areas that are important and support in your body as a whole, right? Then we look at those functional labs again to connect those dots and show patterns. The goal is to help you understand your body better so you could take practical, informed steps forward. A lot of people guess. A lot of people go to Facebook groups, right? They go into these forums to understand what they're going through. Everybody tries to compare their body to somebody else's body. What works for one will not always work for another. We see a lot of people that go on hormone replacement therapy thinking it's because their hormone levels are low, when in fact it's an issue with the thyroid. They have the same overlapping symptoms. So hormone replacement therapy, or those with hormone issues and those with thyroid issues, a lot of times it's the same symptoms. Something to think about. One of the biggest reasons people feel stuck is because the information they receive does not always match how they feel. You're going based off what other people are saying in Facebook forums, that everybody's an expert, everybody's a doctor, everybody's a health coach, everybody knows everything. Yet they try to sell you a product, or they're trying to, guide you in a misdirection. And sometimes it's not because of they're doing it on purpose, but because the lack of knowledge. They think they know it, or it's individualized. Maybe that works for them, but it could damage your body. And people don't always get that. They just said, hey, this person in this Facebook group said, take this, I'm going to try this. And then they're coming to us because they damaged their liver, their kidneys. They're having more health issues. Now they have MCAS. Now they have all these thyroid issues. Now they have this going on because they're following blind advice from somebody else in some Facebook group. Again, people feel stuck. We get it. People are frustrated. We get it. But it creates confusion. It leads people to believe that nothing's wrong, or, it's impossible to deal with. And that's not always true. Remember, standard lab testing often focuses on limited set of markers. While these tests are useful, they do not always provide a full picture of how the body's functioning. A single number can only tell you so much. From a broader perspective, it can be helpful to look at additional markers and those trends over time. This allows you to see patterns rather than isolated data points. Patterns provide context, and context leads to better understanding. Another reason symptoms are often missed is because they're common. Fatigue, brain fog, weight changes, mood shifts can all link to many different factors. Because they are so common, they are often dismissed or attributed to lifestyle without a deeper look. That's where a more structured approach can help. Instead of guessing, we gather information. We look at how different systems interact. You're building a clearer picture over time. And that's where functional lab testing again comes in. I kind of harp on this because people do not know what functional lab testing is. It's very different than conventional lab testing. It's not a typical blood test you run from your doctor. It may be a urine test, maybe a saliva test, maybe still a blood sample, but it's different labs that we're running versus your family practitioner. So something to keep in mind. You have any questions, want to see samples, anything like that, feel free to reach out at Mindful Objective. And remember, we guide clients through functional lab testing and help them understand what their results are and how to develop a wellness perspective that fits them, right? Specific to them, not specific based on, other lab markers and for other people in a group. We focus on education, lifestyle support, and structured planning. Now that you have a clear understanding, I hope, of how the thyroid works, how it feels when things are off, and what's often missed, the next step is understanding how to support your body in a practical and realistic way. First thing to keep in mind is this: supporting thyroid health is not about focusing on one single solution. It's about supporting the systems that the thyroid depends on. You may see in these Facebook groups or on a TikTok video, take this one pill and it's going to help with your thyroid. Your thyroid doesn't work like that. And this is where a lot of people get stuck. They look for one supplement, one diet, one quick fix. The body does not work that way. It works as a system, as we talked. Again, the support is that foundation. Focus on that foundation first. This includes nutrition, includes your sleep, includes stress management, includes movement, and includes awareness. These are not complicated concepts, but they are often overlooked or applied inconsistently. So let's start with nutrition. The thyroid relies on certain nutrients to function properly. Iodine is one that people often hear about, but balance matters. Too much or too little can create challenges. That's why it's important not to guess when it comes to supplementation. And iodine is one of those ones. You could really damage your thyroid. So remember that. Don't just blindly take iodine or high amounts of iodine. It could cause a lot of many health issues in your body, especially with your thyroid. So selenium is another key nutrient that supports conversion of thyroid hormones. It also plays a role in protecting the thyroid from oxidative stress. Foods like Brazil nuts, seafood, eggs, these are common sources. Iron also contribute to how the body produces and uses those thyroid hormones. Something else to remember. Another key nutrient that's often overlooked is vitamin D. Vitamin D plays a critical role in your immune system balance, your hormone signaling, and your overall metabolic health. Many people have low levels without even realizing it, especially if they spend a lot of time indoors or live in areas with limited sun exposure during parts of the year. It's still important to supplement with D3, K2. Again, you don't want to take D3 without K2, and a lot of times too, you want to get in a healthy range of say 50 to 70. You may show up on your test at 30 and your physician may say that's okay, but to be optimal, we go for that 50, 70 range. From a broader health perspective, vitamin D status can influence how the body regulates different systems, including those connected to the thyroid. That does not mean vitamin D is a treatment for thyroid issues. It means it's one piece of the larger puzzle. Zinc is another important nutrient to keep in mind. It supports how the body produces and utilizes hormones and also plays a key role in immune function. Low zinc levels are very common, more common than people think, especially in individuals with limited dietary variety or digestive concerns. We focus on that awareness first. We want to make sure you're doing the right thing and you understand what you're getting yourself into and understand your issues. So instead of jumping straight into supplements, it often makes sense to look at your current eating patterns first. Are you getting consistent meals? Are you including protein, healthy fats, fiber? Are you eating in a way that supports stable energy throughout the day? This is where food tracking is very important. You want to understand what you're getting or nutrients you're getting, start food tracking. It's very important. It's a pain, right? A lot of people don't like to do it, especially long term. But if you're able to do it and you really want to paint a picture, that's the way to do it. That's the first place to start, I always say. Rather than coming to a health coach and getting all this advice, start food tracking first. Try that the first 15 days. See, how you're doing. See where your nutrients lack. See what more you need for you, specifically for you. So again, blood sugar, this plays a bigger role than people realize too. When blood sugar levels fluctuate throughout the day, it can create additional stress on the body. Over time, that stress can influence how your body regulates energy and hormones. Eating balanced meals that are consistent and at consistent times can help support more stable energy, and it'll help reduce unnecessary strain on the body. Next, we always talk about this, is stress. This is one of the most important, often underestimated factors. Chronic stress affects how the body prioritizes energy. When stress is ongoing, the body shifts into a state where it's focused on managing that stress rather than being optimal. That does not mean you need to reduce all stress. That's not realistic. It means you need to create space for recovery. This can include simple things, walking, spending time outside, especially since it's getting nice out, breathing exercises, or just having time during the day when you're not constantly stimulated. Maybe just lay in bed for 10 minutes, stay off the phone, just sit there, think, relax. Sleep is another major piece we always talk about. This is where your body resets and recovers. If sleep is inconsistent and poor, it becomes much harder for your body to regulate itself. Many people try to fix energy issues without addressing sleep, which makes progress difficult. Movement also plays a role, but it's not always better. Consistent moderate movement tends to support the body more efficiently and effectively than pushing too hard without recovery. Walking, strength training, and low moderate intensity exercise can be helpful when done consistently. Again, don't overdo it. Maybe you just need to get out and walk. Maybe you don't need to do high intensity training. Maybe you just need to walk a little bit, Start slow. Another area that often gets overlooked is environmental exposure. Everyday products like plastic, personal care items, household cleaners, these all compound in the body over time. This is not about creating fear. It's about creating that awareness and making gradual changes whenever possible. Again, do what's best for you. Start slow. Or like they say, don't always for people that need to eliminate grains and stuff. Well, initially, start off by switching just to organic, right? See how that affects the body. Then slowly reduce that and increase other natural and healthy, whole foods that we suggest, that Mediterranean diet. Look more into that. And like we said before, gut health is another connection point here. The digestive system plays a role in how nutrients are absorbed and how certain processes affect and body function. Right? Supporting digestion through balanced meals, fiber intake, and overall lifestyle habits can have a broad impact on your body and how you feel. Again, instead of trying to change everything at once, focus on being consistent and having manageable steps. Small changes done consistently tend to lead to better outcomes than large changes that are hard to maintain. So many people just dive full force in and then quit. So don't do that. Start small, make consistent changes, and, focus on that long term goal. This is also where testing can provide direction. Functional lab testing can help identify those patterns related to nutrient levels, to your stress markers, and other systems connected to your thyroid. This is not about diagnosing, it's about gathering information so you can make better informed, healthy decisions based on your numbers, not based on somebody else's symptoms. So, what we do, we work with clients on that. We help review lab data, we help identify those patterns, and we build structured wellness plans that focus on changes. Everything is done within a coaching framework with the understanding that medical concerns should always be handled by a licensed provider. For those who prefer a more independent approach, again, run your own labs. Kind of look at your markers, understand what you're looking at, and knowing how they're changing over time. And then when you need help, you could always reach out for help. So no matter what path you take, the goal is the same. You're trying to better understand your body, again, your body, so you can support it in a practical way. One of the most important mindset shifts is moving away from quick fixes and towards those long-term consistencies. The body responds best to steady, supportive habits over time. When you focus on the foundation, everything else becomes easier to understand. You're not trying to control every variable. You're trying to learn how to support your body and to function to make it more efficiently. As you move forward, start simple. Pay attention to your energy. Notice how you feel after meals. Look at your sleep patterns. Build awareness first, then take action. And if something has felt off for a while, that is worth paying attention to. Not jumping to conclusions, but asking better questions and looking a little deeper. That's where real progress starts. As we wrap things up, I want to leave you with this. If you've been feeling tired, struggling with your weight, dealing with brain fog, or just feeling like something's off and you cannot quite put your finger on it, don't brush it off. And don't just say it's stress or getting older. Your body's communicating with you. The question is whether you're asking the right questions to understand what it's saying. The thyroid is one of the most powerful and underappreciated regulators in the body. When it's working well, you may not even notice it. When it's not, you feel it's almost everything, right? The good news is that you're getting the right information. You have the ability to get the right testing and the right support. Thyroid function can improve. People who have felt stuck for years often find that when the thyroid piece is finally addressed, everything else starts to move forward. You do not have to figure this out alone. You do not have to keep pushing through symptoms and hoping they eventually go away. There is a path forward that starts with looking deeper, understanding your body's patterns, and giving that support to help your body function better. As you move forward, again, start where you are. Pay attention to how you feel. Notice patterns. Ask questions. And if something has been bothering you for a while without clear explanation, that's worth investigating further. So thank you for spending time with me on Mindful Objective. Keep learning, keep listening to your body, and keep taking small, steady steps forward. As always, this show's for educational purposes only. Speak with a qualified healthcare provider before making any changes to your health routine, especially if symptoms are severe or changing quickly. I'll see you next time. Stay well.